Welcome to Season 3 of B'madzaje Ginonindwa. This podcast is produced by the Communications Department at the Anishinaabeg Nation. We will be focusing on the issues and initiatives in Anishinaabeg Nation territory. I'm your host, Lisa Abel. In this episode, we're talking about diabetes, but not just from a medical point of view. We're really looking at diabetes as it shows up in our First Nations and how it's connected to our histories, our food systems, families, and ways of being. I recorded this conversation at the Anishinaabeg Nation Diabetes Conference, where I sat down with two Anishinaabeg healthcare professionals, Shelley Livingston and Donald Corbiere. Both bring personal experience, community knowledge, and many years of work in health and wellness. Shelley Livingston is a citizen of Beegtegaan, Anishinaabeg. She is a registered nurse and is currently the Health and Social Services Director for Netmizagamig, Anishinaabeg. As an Indigenous health advocate, Shelley serves as a board member for several health systems, including co-facilitating the Nujamawing Sukatagaying Ontario Health Team's Collaboration Council. At the conference, Shelley gave a talk about supporting her teenage son, Rick, who was recently diagnosed with diabetes. To help and support Rick and other local young people living with diabetes, Shelley co-founded a youth wellness group. Donald Corbiere is a citizen of Weequampong unceded territory and a registered nurse who has worked in public health and with the City of Toronto Indigenous Affairs Office. He has contributed to several Toronto area Indigenous advisory boards for local hospitals and housing providers. A few years ago, Donald returned to his home community to work as a community health nurse at the Weequampong Health Center. He was inspired by a cousin who had received a message from a shaman in Mongolia who shared that we need to go back home to support our nations and support Aki, Mother Earth, and make sure she's healthy and well. Part of his work includes supporting people in living well with diabetes and focusing on the well-being of children and youth. He is also known in his community as Dondi. Together, we talked about what it means to live well with diabetes, why culturally safe care matters, and how reconnecting with traditional foods, land-based teachings, and community-driven approaches can make a difference, especially for our children and youth. It's an honest, thoughtful conversation about challenges, but also about hope, resilience, and healing. Welcome, Chimigwech, for joining me today with our podcast, B'madzaje Ginonindwa. So welcome, Donald, and welcome, Shelley. Miigwech for being here.
Miigwech for having us.
Ani Wache, and happy to be here. I say Wache because my husband's Cree from Peawanuck.
Mm-hmm. So today we're here. I'm meeting with you at the 4th Annual Anishinaabeg Nation Diabetes Conference. So we're here to talk about our First Nations perspectives on diabetes in our communities. And I'm looking at the agenda, and it's a really amazing opportunity to share discussions about how we're managing diabetes in our communities, but also I'm already getting the sense of the importance of integrating our medicines, our teachings, our foods also into diabetes care as well. So I'm really interested in hearing your perspectives on this, how you're doing this in your communities.
Yeah, when I think about diabetes and I think about being a nurse in the healthcare system and having that perspective from the healthcare system versus our own way of being, a very different perspective on things. And I think that, as moving in the work, especially living as a community health nurse for 15 years, diabetes was a big part of what I did for my community. We almost like a fall down the rabbit hole thing, right? Because so many different things are connected to diabetes, and it's really not just the condition of diabetes. It's so much more than that, and it's hard to really even process how much that is. it's taken me years, if not decades, to really understand what is diabetes.
When you're explaining to a community member or to the community, what is diabetes, how do you really explain it, what it is?
So I'm not as in the front line, I would say. For me at this point, working with diabetes is more a personal experience, just working with Rick, who's 17, living with diabetes, and his friends and my cousin. I spoke about our wellness group that we did start, and like I said, they're under 25, and 4 out of 5 of them live with diabetes already.
Your presentation this morning to the conference really touched upon your personal and family experiences with diabetes.
In terms of like the community experience, I did share my personal story this morning around, having my dad pass away at a very young age, and it was diabetes related, and having my sister, who's only 39 now have to live with the complications of diabetes after living with it for decades, and even now supporting my 17-year-old who's just been diagnosed with it, and what does his pathway lay in front of him. So when we talk about diabetes, we do have to start back with the pieces around, the physical space of diabetes, which is, the insulin and the resistance, and then trying to not overwhelm them either, because, this is really complicated and complex when we talk about diabetes, and I still really don't know if healthcare professionals truly understand that. I would say, of course, our healthcare professionals who are working within our own systems, and who have that opportunity to actually get to know the people they're working with, that understanding gets built. But I would say when we're trying to step into that clinical space of diabetes treatment, there's still a lack of understanding about what is diabetes, and so that kind of clicked for me that there was a larger thing here that nobody was talking about, at least especially in the healthcare field. I would say when you talk to physicians, there's even still to this day, there's still not a real recognition about what diabetes really is as a chronic disease. Like there's just a real disconnect from our communities and how we live and experience diabetes. And even to go a little bit further, being asked to come and present for this conference and even to do this podcast, I really had to do some reflection, because the other piece, and I feel like this is that way of being piece, being Anishinaabeg and being raised in my values, I allow myself into spaces and trust that I'm where I'm supposed to be in terms of creation, right? Just put my faith in creation, and I'm where I'm supposed to be, and I'm there to share whatever it is I'm meant to share, and I try not to do much controlling around that. But to be ready to step into that space, I really had to do some reflection on my own personal history with my family even, right? So, thinking about my grandparents, thinking about my dad, and thinking about the people that are now gone, right? And why and how. And I think about even just, it's not just one trauma. Like we all have the intergenerational trauma that we're born into, right? We're born into a system that was never built for us, and in fact it's still trying to erase us, and so we're born into that. But then we're born into the effects of that too, which is a separate trauma, right? So that intergenerate, the one where we're trying to be erased, is not happening in our home, but it is happening around us. And then there's the effects of it, which that's where you see the substance use, that's where you see the dysfunction, that's where you see the impact of things like residential school and impact of 60s Scoop, the grief on top of grief, the suicides. That's really heavy, hard, difficult things. And so I think about my 17-year-old, and I think, how do I explain that to him? Like, how do I do it? And I can't do it all at once. I have to do it in little snippets and pieces, and I have to have multiple conversations with him about why and how. And honestly, that'll likely still take us years to get through. I think that when we frame a lot of the stories, we don't always have the compassion either around, it's instead we just sit with the judgment of it and we internalize it versus like, man, that must have been difficult. I can't even imagine, right? But yeah, I think it's so complicated, and you can get so lost in the stories that it's hard to really remember what you're doing there in the first place when you're trying to reflect back on how are you going to move forward with this and why, right? It's the why. But I think the value though of being able to do that is that you do get to have these moments of understanding, and you do get to have these moments of grace, and that helps to clarify that you as a human being living through what you've lived through, whether that you've experienced that yourself, because likely you have experienced some form of violence or whether that's abuse or however that managed to look for you. But without speaking about it, without understanding it, we tend to internalize it, and we make it our fault. The narrative in our heads is, I did something to deserve that, when that's not even close to being the reality. The reality is you're plopped into a system that put all of this in motion, and none of that has anything to do with who you are as a human being. And that's the part that gets not recognized, or that we as living through it have trouble making that step into the space where we have the grace for ourselves. So it's a long way to say, long way to answer your question, but
I feel like I understand what you're saying, because you mentioned a lot of things. You mentioned this intergenerational trauma we've experienced that continues to be in place today through these different social determinants of health that aren't as strong or as positive for Indigenous people or in the Indigenous communities, and that are impacting all sorts of different aspects of our health. You're saying our physical health, our mental health, our spiritual health even. And I connected also with the idea how our way of being, how it's a lifelong journey to explain this and to support our children and the next generation as well, to understand these systems that are around them. And that, as you're saying, the things that are happening are not necessarily our personal fault, but are really as a result of these systems and these inequities that we're surrounded with.
Yet they have a very large impact still on our health in many different forms, actually. You're right. Yeah, I did speak to, because I think, again, when you peel it back, the other thing that I deal with day to day is substance use in my job, right? And it's another one that, again, when I look at the stories in our history, this is what drives it, right? Like, this is what drives those pieces of things. I think the diabetes is a little more complex in that, there's food systems that we don't have control of. So, for example, like the grocery stores and those pieces, like there's a whole system there, that wide array around what food insecurity actually looks like in our communities. Access to food, especially at home, because not everybody has a vehicle, right? Not everybody can go to the grocery store. And then when you do get to the grocery store, if it's next to a small town, it doesn't have the access even then. And that's only in the road-connected communities. I can't imagine how difficult this is in the communities that are more remote, and with the huge prices and just the difficulty with travel within Canada. So it was really trying to understand all of that and trying to put into motion where I can, what I can do as a nurse with the influence that I had. And so doing a lot of work again with the youth, and then with the new moms, and that really was, the basis of a lot of the work I did as well. Whereas mental health is a little bit different. I think we just don't have the adequate resources to really just be able to deal with people on a one-to-one basis how people need to. And then the fact that we were already disconnected from each other, and our being disconnected from each other just adds to it, right? So yeah, it's complicated and complex that way too. So I am saying a lot because it has impacts in so many spaces, if that makes sense.
It does make sense.
Yeah.
It does. You mentioned, the idea of the intergenerational effects of colonization and trauma. Is there a connection between diabetes itself and the history of colonization? I know we have talked about, this morning we heard about the relationship, between our access to food on the land and our diets, for example, historically, and then even now, as you mentioned, being in First Nations communities that might be remote and away from secure access to food. Donald, are you doing any of that kind of work in your community, really, that
well, yeah, and again, like, I don't ever just talk about to the kids like what diabetes is, or this is what diabetes is, and talking about the physiological aspects of it. Like, I talk to them about what my grandparents taught me and what my parents taught me about how to live well. Like, my aunties and my uncles and my grandparents and my parents, they freak me out because they never stop moving. They're always doing something. They're always working, right? And they taught me a lot about my relationships with food. And so my dad would always make sure to go to the apple peddler in Espanola and grab fresh fruit. So we always had fresh fruit. And my mom, like, every day we had dinner together. So my mom, even though she was the principal of the school and director of education, she still made sure that we all ate together every day. No matter what, and she would prepare the meals. And so, and again, I learned from my nieces and my nephews and how they've raised their kids, and because they're the next generation, and they've kind of overcome a lot of this colonization stuff, and they can point it out too. Like, they can point out the behaviors that are in my mom or in myself and in my sister and like in our dad. And so these are behaviors that are from colonization and from them being in those systems and being at those residential schools and that kind of thing. But these young people, they're so smart. They can point it out, and they can, I'm not doing that with my kids. You know what I mean? And so, like, this stops right here. So yeah, like, in my work, again, I don't ever just talk about diabetes. I talk about, like, you need to be outside, you need to get some sunshine, you need to be walking 4 times a day, you need to be eating eggs every day. And so my big thing right now with the kids is to get them to understand that cereal's not a healthy food for you. But meanwhile, it's these food systems, it's the company that's telling parents, oh, you need to eat cereal, it's good for you. But that's bullshit. A piece of properly made chocolate cake actually has more vitamins and nutrients than cereal. You know what I mean? So
I need your recipe.
Yeah. So I mean, because butter and cocoa, and cocoa is an indigenous food, right? And we have all these foods, and then also some of these narratives too. It's like, whose story are they telling? Like, like 70% of our diet was complex carbohydrates, right? And so there's plants out there like plantains, like purlane, that grow all around the world, and that our people would have harvested and ate every day, and that would have been 70% of their diet. But
I guess there's some loss of that knowledge, though, of those plants.
But that's colonization, right?
You're mentioning purlane, and I only recently found out, like,
it's a superfood.
But I was like, oh, this is a weed. I was pulling that out of my garden. And then we need to reconnect with the idea of these indigenous native plants that are actually highly nutritious.
And our people were eating it all the time. Or even like cedar tea, right? And they were talking about medicines, but cedar tea is just like, it's everywhere, and it's just full of vitamin C, and it makes you better when you're sick, or even yarrow or Labrador tea or bush tea. We had our World Water Day last week. We kind of did it a little bit late, but my husband got some bush tea he's from Pewanik and Hudson Bay. And so, like, yeah, the kids were loving the bush tea, and they're like, oh my God, it tastes like the earth. And so, like, they have that genetic DNA memory, and so their bodies remember it, and they're just like, oh my God, this is the best thing, because they've never had bush tea, right? But like, traditionally growing up, we would have had access to all of these, right? And so I think that's what my grandparents and my parents always did, things that they understood were good for you and healthy for you. And so, like, my Uncle Don famously started eating garlic every day, raw garlic. You know what I mean? So like he would smell like garlic, but again, like he had all those other health practices. Like he would have his salmon or tuna sandwich every day, right? Because fish is good for you, right? And so I think that's what we've lost, and that's what colonization has done, has told our people and told people like my grandparents and my grandpa that, oh no, that's not healthy for you, or you can't eat eggs because there's too much cholesterol in eggs, but which is total bullshit, right? And babies need that choline that's in eggs, and they need to be eating that every day. And my mom just said, we're listening to the harvesting presentation, she's like, oh yeah, we used to go get seagull eggs for the lady just down the beach from us when we were kids, and we used to take them to her and then she would cook them for us. So like seagull eggs. And our people used to eat pigeons, and the pigeons used to be so thick that they would blot out the sky. But people think of pigeons as a weed animal. So like colonization really lost and really destroyed our knowledge base and our connection with Aki and with all of the beings around us, right? I grew up in the Bay of Beavers, and I grew up in a little part of our community called Buzzwell. So I grew up in the waters with my cousins and family, and so I know the water is dead. I know that there's no living beings in there that I grew up with, and so that does make me sad. And so the beings that were lost from the water when I was growing up, like you could turn over every rock and there'd be a crayfish underneath, and so we would have crayfish wars with these giant crayfishes. Now there's not a single crayfish in any of our water anymore. In the spring there used to be freshwater clams that would wash up. The beaches would just be covered with freshwater clam shells, which we probably use to make jewelry and a lot of other things, but now there's zero. The freshwater clams and mussels in all of the Great Lakes and all of the river systems, the Mississippis, they've been completely decimated, and so they don't exist anymore. Even like something like whitefish, there's stories that when this whitefish would come in to spawn in the spring, like to the shoreline, they were so thick that you could literally be walking on water because you could walk on the bodies of the whitefish, right? So now, like in all of the Great Lakes, the only place that has whitefish left is a little bit of where our territory is on the east side of Spirit Island and Point Grundine. And then there's one small kind of little off of Lake Michigan. So in all the Great Lakes, those are the only two places that have whitefish left now. So I think colonization really destroyed our relationship with our mother and destroyed our confidence and our strength in knowing what we need to do for ourselves. So I think that's what colonization did, is it made us feel inadequate, and made us feel like their knowledge was better. But we have to realize, and we need to be telling our kids that we're the survivors of, like, because when they first came over, like, disease killed 100 million of our people, right? And so we're the survivors of that 100 million people that died. And so we need to start telling our kids that, like, we're here because our ancestors survived, and they survived all of this smallpox, they survived all of these wars, and they survived famine. And so I think we need to start telling those stories. And so that's kind of where I like to base my work on. And so I don't ever really talk about what is diabetes kind of thing. I just try and talk about some of this knowledge that I've gained through the years, and also through, like, what you're talking about, working with systems and trying to create safer spaces for our communities, right? And so a big part of my work when I was a social determinants of health nurse and also Indigenous affairs was making sure that so now if you call 211 with the City of Toronto and you say you're Indigenous, then that's supposed to be able to stream you into different systems so that you're supposed to get better service. And so I think that's what we need to do, is create safer spaces for our communities all across Canada, so that they're not dealing with racism when they go to an emergency room, so that they're not, when they call CRA, they're not dealing with someone that can't get a translator for them, when meanwhile they'll get a translator for everyone else. So I think a big part of supporting people with diabetes is just trying to support safer spaces and that kind, loving embrace that our communities need and have, because of colonization, have kind of been destroyed, if that makes sense.
It does. So, you touched on the importance of our knowledge of our traditional food systems and the importance of having this culturally safe care, these really, safe spaces for us to access care for diabetes. Shelley, how is the access to traditional foods in your community and these healthy food habits in your area?
Yeah, so again, in Beetigong, we're quite lucky that we've got the school, Beetigong NJ Kinnamading, really does put a lot of focus on land-based activities. So there are things like the moose camp and the fish camp. It is very difficult, I would say, for sure, to go beyond that harvesting piece, whereas it's not only harvesting. There needs to be more emphasis on the medicines as well, because they really are just outside your door, right? They literally are right there, and it's just we don't recognize them anymore for what they truly are. I think there is some environmental risks at things too, whereas one of the values that I grew up with was, the animals know what's good and they'll eat the medicine, and that's how they live their life because they're still in harmony with their natural world, whereas we're not in harmony with our natural world and we do things that are not good for us for other reasons. So when you go and eat a moose, it is medicine. It's not just something to feed your body. It's literally feeding all parts of your body, and there's more of a holistic view of that. But again, it's also a tough sell, I'd have to say, which is really, really difficult. So coming from Beetigong, where we've really prioritized trying to put those connections back into place, so teaching our children that so if they're going to go snare a rabbit, that there is a responsibility to that rabbit if you're going to take that rabbit, right? So that piece of things. So we're in that process right now of really knowing and understanding what those practices are and how we can support those practices. As I said, in Beetigong, even with the system sort of pushing towards land-based, having it with our children, it is still we are so colonized that it's tough to put down your own personal views of things, like that the rabbits are a nation and the beavers are a nation, and we have to have nation to nation responsibilities, and it's the same with the plants as well. They're nations as well. So if we really want to get back into harmony with them, we have to first recognize that and take off this that it's just food, because it's not. There's lots that come with it, and we need to understand that a little bit more, or at least be willing to be a bit more open about it. And I think that's where the jump is. That's where the little bit of the gap is in trying to really support some of these initiatives. So it is a lot of conversation. And I would say the other maybe reason why some of that's difficult too is that our communities really are in a space where they're suffering as well. And so their priorities are not necessarily going to be, what do you mean I have to have a relationship with the clover? Their priorities are going to be like, this really hurts right now and I don't have help. So it's really not that people are not willing per se, it's just where people are at is a really difficult space. And so to kind of hopefully to bring it in a way that actually helps support them in what they're actually experiencing is kind of the hope and what I'm working towards, particularly in the community I serve, because I get to be active in that. In my community I live, I'm more influenced. I'm not so active because I don't work for my community anymore, and I at least have a little bit of influence there. But yeah, so it's two different things, but essentially the same thing, trying to really support that reconnection back to the land.
Mm-hmm. So it sounds like as much as we do want to move past these effects of colonization, that it's still quite a challenge to do so. And I guess the idea of, say, for example, going out harvesting, that's not a singular event. It's something that has to be connected to a larger body of teachings and experiences throughout our lifetimes, right? Donald, you had also brought up this idea of the culturally safe care. Shelley, what have you observed in terms of access to culturally safe care for diabetes, either diagnosis or treatment?
Yeah, so like in terms of the culturally safe care, it's something else that does have a big impact on the people who are living with diabetes. In my small community, we are serviced by a family health team that has about 6 or 7 physicians. They have also an NP and a physician's assistant. So my current journey with Rick, he was diagnosed in June of 2025. It's April of 2026, so it's been a short time frame. We've had maybe 5 interactions with physicians, and of those interactions, unfortunately, only one of them was culturally safe. Some of the things that were asked of Rick or told to Rick was really unnerving, and I was really glad, number one, that I'm in the position to understand what was happening in front of me, that I could like basically say, okay, stop, we have to rethink about this, because it's hard to come up with the exact piece. Some of it was, we walked in and one of the physicians looked at him, and he's, like I say, 6'2", he's a big kid, but when you look at a 6'2", he looks like a man, right? Is the other piece,
But his brain is still young.
But he looks like a man.
Still a teenager.
Yeah. But the point is, when we walked into the office, one of the first things that he was told was, "Oh, you can reverse this. It's totally within your power. If you eat all of the right things, and if you do this and do that, you don't have to live with diabetes." And it was like, okay.
How does a First Nations person take a statement like that?
Unfortunately, I already knew any interaction with doctors. Rick already has a lot of anxiety, and I could already see like the look on his face was kind of like a deer in headlights. Like, what is this person talking about? Because I don't understand what you're saying to me right now. Because even in that interaction, there was no. So I call it this: you put Rick in front of a big cliff, and he has to look up at the top, and you're telling him, yeah, you can get up there, you can do that, it's all within your power, but you've given him no pathway, no ladder, no anything for how he's going to get on top of that cliff, regardless of whether he can get up there, right? Which, I think has to be said, yes, he can do that, but you've given him like no pathway to do it. And so in terms of that visit, what you've actually just done is you've just told Rick he's a failure. You've given him the beginnings of like, oh, it's in my power, but I'm not doing it, and I can't, and I haven't been able to do it, even though I'm trying really hard. You've just told and given the message that he's a failure. And I think that's healthcare. That's what healthcare does on a regular basis, and they do it in a variety of ways. Not so as that was pretty overt, like an overt way to do it. Like, as helpful as that doctor thought he was being, he really wasn't. And so the other oh well, do you take your medication? Do you do this? But no real like processing about like, how's it been since you've been diagnosed with diabetes? Tell me about that. Like, there's none of that. It's all about, are you taking your medications? Are you checking your sugar? Oh, well, if you're not doing that, why am I even here? Why are you even here talking to me if you're not willing to do those things? And that's been some of the other more common interactions. And some of them has just been like, whether that's just a human disconnect from, maybe Rick just didn't connect with that person either, right? And there's not really any room for that in the healthcare system either. Whereas like a person, I don't vibe with you, so anything you say is not going to really resonate because I don't want to hear it. Regardless of why, that's the other reality of our healthcare system, is that's not meeting Rick where he's at either. So those have been our interactions most recently, and so that is in the last however many months it's been, 10 months, in terms of what this is like. So really, in terms of like the cultural safety or trauma informed, close to non-existent. The only real space that we've stepped into where we've felt seen and heard has been with a physician who was experienced. And now that I'm understanding a little bit more around obesity, she's actually done the work to understand multiple things and realizes that diabetes is just one of multiple things, and this is just the way that it's presenting right now. So it isn't about the diabetes, it's about all of those other pieces that have an influence on the person in front, right? And so when she comes in, she has been more, it hasn't been such pointed questions, it hasn't been judgment. She's been able to get to Rick's level to say, that must be difficult, right? Just a simple acknowledgement of how difficult it is to deal with that goes a long way in terms of validating what the experience is and the safety created. The only other thing I'll kind of mention around the cultural safety piece, and my community, Bichagong, and the community I work for, we're serviced by Dalico. They have their own healthcare team as well. The other piece of that is they also, because they service only Indigenous, there's a lot of those pieces that we don't have to put together for, because that was the other thing, right? So I'm walking into these appointments with Rick and they're giving him these pointed questions about certain things. So I'm having to back them up so that they can, number one, meet Rick where he's at, but then also have an understanding of trauma and understanding of food systems and understanding of different pieces where I'm able to voice those pieces. So Rick hears, but they hear too. It's almost like a learning for them, where they haven't really had it said to them in that way, right? But the thing about Dalico, or the value I see with Dalico, is because they have multiple touch points with Indigenous, that's already built into the care, and they have been responsive, and we haven't had to draw the lines of colonization for them because they already understand and know that this is the reality of being Indigenous in Canada. I'm sure other places as well, but for us, yeah.
I think that all speaks to like Shelley often talks about these systems that we're dealing with. And so I was chatting with my boss one day and I was like, so why is it that like when I go see my doctor, it's a full physical and like he does everything and he does the full body exam and does all this blood work. And I was like, so why is it that none of our patients get actual physicals anymore, or did they ever get physicals? And so my boss is like, well, Dondi, the funding is such that physicians only get paid for a problem-focused visit, and so they're only going to get paid to deal with diabetes. They're only going to get paid to deal with hypertension. So they're not actually there to work on a person as a being, as getting just a physical, which is something that I thought was so common. But like even that's us, our communities butting against these systems where now it's because of the change in the fee structure for physicians in Ontario, now they only get paid for that, to deal with the diabetes. They don't do physicals anymore. You know what I mean? And so we're struggling against these systems, and especially in the north where my husband's from, Peawanik, they only have that person in front of them, like whether that's at the Moose Factory Hospital or Moosonee Hospital, or whether that's down in Kingston with the specialist. They only have that person in front of them for 5 minutes because they're a specialist, and so then they go back to the community. So then what's happening up north again is because they're just dealing with these one problems. There's a heavy amount of over medication in the communities, So I think, again, it's interactions with these systems and just the way that unfortunately things have to work. And so people don't go to the Emerge when they have an infection, and so they're dying of sepsis because they don't want to, because they have to deal with all this racism, right? So I think, again, like diabetes is just one of many, 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 many different things that are the effects of these non-safe spaces where people aren't being treated kindly, where people aren't feeling supported or loved or nurtured. And so it's just a symptom of the problems that exist in our systems and because of colonization. And when I was with the city, we used to do like a lot of equity and diversity training and teaching people about oppressed people, and this is what happens to people who are oppressed in oppressed groups. And if you look at that and you do any of that work, persons or oppressed groups, they all share the same characteristics. And so it doesn't matter if it's for mental health, doesn't matter if it's because you're Black, doesn't matter if because you're Indigenous, or doesn't matter if because you're an old person, or doesn't matter if you're dealing with like a disability. You're oppressed for the exact same reasons for all of those groups. And so I think that's why, again, these things like diabetes are just a symptom of all those generations of oppression. And generations of oppression on our DNA ingrained in our body, right? But we can fix that, right? And so I think that's our jobs, is to start telling our stories and to start bringing back our knowledge and start getting the rest of the world to know that a lot of what you do, a lot of these parenting skills, a lot of these food ways, those came from our people. Those came from our nations. And so the rest of the world needs to start acknowledging that. Where would the world be without tomatoes and potatoes, right? So like that was our food. Like, come on. But they never acknowledged that. Or where would our world be without these parenting tactics that came from the gentle nurturing and guidance of little ones, and letting them make mistakes, and giving them chores and giving them responsibilities. How important that is for kids to develop their sense of self, right? And how helicopter parenting doesn't work, and it's destroying our kids now, you know? And so we do round dances in the community, and we do this one, my boss really organizes it every year, and that's kind of one of those situations where I can really see it as like, holy, these little tiny toddlers, like they could barely walk. They're walking around, you know, the round dance with the little babies in their arms. And so they're being given that role and responsibility. And that's what our nations used to do. Like, everyone has roles and responsibilities, and they're taught from when they could barely walk. Okay, you need to put on your own shoes. Okay, you need to clean your room. Oh, you need to help me with baby, or watch baby for a minute. So I think, again, that's how we used to live. And that was how we nurtured our relationships with each other, but also our relationships with all the beings around us. And so I think we need to, again, start telling those stories and getting back to that. And yeah, having situations like round dances where roles and responsibilities are all clearly lined up. And I'm excited about the future, because I think we're now like really starting to get it. And we have like all these amazing champions and leaders and people like, you know, Joseph Pitawanakwit, or even people like I got a lot of my knowledge from Jackie LaValle, who's Potawatomi from Shawanaga, and so like and she talks about, she's very much about like how our people were willing to take on things and learn new things and learn about new things, and we're excited to make deals and to take in that something that was good for our community, right? And even things like this, like a podcast, right? Like, this is something that our communities, they're doing really awesome with. And you know, it's a way of really sharing knowledge and building that love and understanding in our communities. And so fashion, like you can name anything, right? And our communities are really taking that on and going forward with it in our traditional ways, you know? I think it's really exciting, I think.
That is exciting. You're really talking about how we need to acknowledge this interrelation between, you know, our Indigenous ways, our Indigenous culture, and mainstream culture as well. So you mentioned some really positive things that are happening in your community. Like, Shelley, are you noticing some positive or some good community-led approaches that are helping to prevent or manage diabetes? But I think if we talk about it even in a larger sense, that are helping to support community well-being.
Yeah, I think there's a lot of really interesting things happening for sure. I think that we have people who are curious, people who are starting on their own journey of understanding how and what those impacts of colonization are, and people who are curious about these systems and what they're seeing in front of us. I think that what's really interesting, even just, I have a bit of I feel like an additional perspective to the health perspective, just being able to step into sort of that social services role, you know, looking at child welfare, you know, again, looking at land-based, and understanding that when we're talking about solutions, or when we're talking about what's going to make things better, number one, community-driven is so important. it has to meet people where they're actually at, and people are going to be at different places. That common experience in that colonization could be so different that, yeah, that community driven piece is super important. Anybody who's doing that work will know and understand within their little microcosm about what that is. And my only sort of advice to anybody doing that work is look around at your other systems, because you have somebody, you might not have been able to look and bring your head up to see what else is happening. But if you take some time and do that and look at who's next to you doing work similar, I think that there's definitely a lot of points where our solutions are not going to be singular. They're going to be community driven, and that means a lot of different people involved in different systems, even within community. So it's not going to be the health system that solves this problem. It's not going to be a social services responsibility either. It has to be everybody's responsibility to help make things better. But I think that if we go back to our values, and if we allow our values to provide us with some of that direction, I think we will move into spaces where that help is there. The help that you're looking for, that convergence of these might just be two separate workers doing really great things, but they'll converge somewhere, and it'll be magic, you know? I don't really believe in magic, but I do, because I know that as difficult as the problems are that we face in our day-to-day, there are people who are also in it doing the good work. And I believe that those people are magic, because they have a lot on their shoulders, and they're doing so much with so little. And they're doing it usually because it's values driven. They're usually from their community, and it's because they love their nieces and nephews and children and grandparents and moms and dads, and that's usually why gives them that motivation to keep moving forward, even though they're likely swimming upstream with no paddles. That's the magic of it, right? You still manage to get upstream. So, yeah. There's lots of really great work happening out there, and I think we just need to lift our heads up and look at what the others are doing, and we'll find what we need to keep doing what we do. And just another point, like, I think you make a really great point on about the fact that our way of being has so much value to that Western way of health. When I look at that, they will start looking at us, and they have already started looking at us. And I don't mean the systems. The systems are very difficult to move. Like, when we think about systems, we think about whether that's federal or provincial, it doesn't matter. They're very difficult to move. But the people within the systems are looking at us, and they know and understand that there's something there and something of value. They might not be able to put a finger on it, and they might not be able to put it into words, but they know it's there. And I think that's been my human experience in trying to be a system changer, is it's human to human, people to people, and having influence where you can have influence.
Well, speaking of this idea of meeting with other people who are, in other systems who are doing the changes, we'll conclude the podcast so you can get back to the conference and meet and interact with your colleagues, to share ideas. But before we go, is there anything else you would like to add to the topic?
I think also just speaking about knowledge keepers and people that have knowledge and learnings and teachings, and there's so much out there. And so we do have to struggle with the fact that, our elders were in this system too, right? And our knowledge keepers were in this system. So some of those behaviors might be that colonized behavior, right? And like things like skirt shaming or, that kind of thing. But I think because we have so much knowledge coming out now and so much understanding that's trying to be built, it's exciting. And so I think as people that are trying to support learning and love in the community and kindness, I think that we have to take from bits and pieces of those learnings and teachings, like the word Anishinaabe. My community is always trying to define what Anishinaabe means, and they're actually I think, literally trying to translate it, but the teachings that I got from Clayton Shirt in the city was that Anishinaabe, it literally means a being that walks with goodness and good intent. And so I always take that meaning because that makes sense to me. Because if you look at the word Anishinaabe, Nishin is in that, right? And Nishin means good, right? So Aki, or like a being that walks with good intent. So I think that that's kind of the sphere that we're in as well, is we have to use different teachings from different knowledge keepers, and also just be wary of some teachings might not fit with the work we're doing, and also some teachings just might kind of do more harm than good. So I think it's an interesting situation that we're in, that we'll have to amalgamate all these things and our different learnings. And so that's why I'm really big on leaning on some of those teachings that I really that make sense to me and make sense to how my ancestors would have been. So yeah, I'm excited for the future, because I think our communities are doing really amazing things, and like you said, community-led and community-driven things. And so, because I come from public health, I spent many years with public health, and so I want to also try and like parachute in some of these public health policies, because like I do struggle with being in the schools and talking to the kids about, you know, not having juice and not having cereal, and then, you know, they're at the hockey rink and the only thing there is to drink is pop and slushies, right? So I want some of that public health policy stuff that's kind of top down in the community, because parents aren't being supported, right? And then my teachings to the kids aren't being supported to the kids, because if they show up at the arena and the only thing they have to drink is juice or a slushie, you know, like, oh, Dondi said I can't drink that. Like, what are their options? And there's no healthy food there. Slushies are not a healthy thing. I don't want them served at the arena. Anyways.
That is an important point.
That's my big thing, is I think we do need to kind of amalgamate and kind of have a little bit of both. So I do want us to kind of incorporate some of that parachuting in, not so much community-led, but also community-led, you know what I mean, to try and figure out how that works. Mm-hmm. Yeah. I want, for some of these bigger public health stuff, I do want our communities to work harder, to give the kids on the reserve the same opportunity that the kids in the cities got. Because like I have friends too that have moved back to the reserve from the city, and they're like, oh my God, I can't believe all the pop and juice, and they're shocked by it too, because they're coming from the city systems and then coming to the res where we don't have a lot of these public health policies. And so I want there to be both. So that's kind of my perspective, because unfortunately parents don't know, and grandparents, which is traditional, are raising a lot of these little babies, right? And so it's that building that knowledge, but making sure to support them in that when they're at the arena with their grandkids, that there's options there. I think we need to kind of, like Jackie LaValle said, pull in some of those new world things, and but also like amalgamate it and steer our canoes same direction, but from our different canoes. Yeah. And Chimigwech, yeah, you guys are awesome. It's been nice chatting. Yeah.
I think you're absolutely right. Yeah. Community driven, but it does need support in terms of that public policy piece of things. Very important. I think that, you know, if anything too, just, you know, our values, who we are as Anishinaabe, it's still there as much as we have to uncover it sometimes, because, you know, I think when we think about public policy especially, that can be a little bit more complicated and complex around, you know, our value systems, but I do feel it is still there, and it's not always just the 7 teachings, right? It's something like no one gets left behind. And I think when we think about public policy and we think about community driven, it all converges. And so I, like you, am also very, you know, hopeful looking at the future, especially when you have some influence on that, or you've got some lived experience or some additions. So I think that, you know, even just being on a podcast like this as well, or having the opportunity to speak at different spaces, all will help in terms of making that difference. Yeah.
Well, Miigwech, Shelley, and Donald for taking part in the podcast, and I wish you all the best at the conference and back at your work and your home communities with your families. Miigwech.
Thank you.
Miigwech. Miigwech.
Chimigwech to Shelley Livingston and Donald Corbiere for taking part in the podcast, and to the Anishinaabeg Nation Health Department for supporting this episode. To learn more about diabetes resources available to First Nations and to download a transcript of this episode, find the links in the podcast description. This episode includes the tracks Mino Pamatsuin by Nigel Irwin and Chippewa Travelers, and Hard Beginnings by Grayson Grit, provided by Nagamo Publishing. Chimigwech for listening to Bamadzaje Ganonendwa. Until next time, Bama P.